By the year 2020, it is estimated that 1 in 6 Americans will be 65 or older. A commission on the needs of seniors in the 21st century told Congress this country's changing demographic makeup is a quiet crisis. Quote, "The dramatic, unparalleled increase in sheer numbers of persons over 65 will do more than challenge our housing resources. It will exhaust them, unless we are ready." Are policymakers listening? James Sykes says no. He was a member of the Seniors Commission. Sykes was in Washington for a series of discussions on how cooperatives could help fill the future needs of the elderly.
I see nothing in place that would make me feel that there will be, that housing for the increasing number of people who need it will rise to public's attention.
Most of the nation's co-op housing, where residents govern, is in New York City, but many of those units belong to the wealthy. Now there are moves to better promote the concept in the heartland of America, to help seniors of modest means, people who have long accepted agricultural and electric co-ops as facts of life. Arkansas now has its first housing cooperative for the elderly in Bella Vista. Financed by local banks and the Federal Home Loan Bank, the plaza was sold out before it opened. In rural areas, homestead co-op housing for seniors gets positive reviews. Gerontologist Jill Eversole Nolan has done surveys. Among the responses she has gotten,
I want to be around people with similar needs. I'm now not alone. We all take care of each other. Those were comments that we got when we started looking at the qualitative research.
Sponsored by the Mutual Service Cooperative Fund of the Cooperative Development Foundation, the Washington gathering also focused on home care for seniors and the growing gap between the need and what is available. In co-op home care, the workers get the chance to be owners, and clients too benefit.
I am firmly convinced that a cooperative is a very good model at building up that level of trust that is critical to the quality of care, that trust and that relationship that you need between the caregiver and the care recipient.
Success stories come in diverse settings. Cooperative Home Care Associates in the South Bronx provides highly rated service for about 1,000 people in New York City. In an industry often known for low pay, poor training, and high turnover, CHCA has stood that tradition on its head. Its core belief from 10 years ago endures today.
That if you create a quality job, you will create or you will produce an outcome that will be measurable and will have high quality in terms of the services that you provide. That you can't have a quality service without a quality job.
In rural Waushara County, Wisconsin, population 24,000, Cooperative Care uses the same approach with its 80-some workers.
They have access to benefits, they have paid vacation, they have backup, and they certainly have support and training, all of the things that Michael has mentioned that are so critical to that workforce.
Still, there are only about a half dozen home care co-ops in the U.S. A major obstacle, startup funds.
In order to support these co-ops, you need to be thinking about where those dollars come from, particularly on the public side. Most of those dollars right now go into nursing homes.
Given that most seniors prefer to live at home, they have a lot riding on the funding equation.
It's clear that there is synergy in this concept of aligning the needs of workers and consumers in a business enterprise. And we're missing the boat in public policy if we don't recognize its value and realize it through greater attempts at replication.
The CDF session also looked at health care. Group Health Cooperative of Puget Sound has hundreds of thousands of members, most in Washington state. It is the country's largest consumer-governed health care organization. It is also considered one of the best. Board member Grant Hendrickson says special concern is shown for seniors, often in unique ways.
We contract with YMCA's private health clubs in a Silver Sneakers program so that any senior over age 65 can go to a health club or to the YMCA free of charge to get the exercise that we think is obviously so important.
But Hendrickson said the current competitive environment makes it very difficult to establish new co-op HMOs. There were upbeat reports on two fronts. Small, not-for-profit hospitals, so important to rural seniors, are better able to survive by affiliating with a co-op called VHA. It helps 1,400 hospitals get their supplies at bulk purchase discounts.
And if they save money on supplies, they have additional resources to invest in nursing, new equipment, and of course, charity care.
And purchasing co-ops like United Drugs of Phoenix enable community pharmacies to compete with mammoth drugstore chains.
Really beautiful about the cooperative model is that the members of the cooperative, our pharmacists, are your neighbors. They live next door to you.
But maybe it is housing that holds center stage in all this. How large a role could cooperatives play in meeting the needs of an aging America, especially when experts say housing co-ops have barely scratched the surface of their potential?
The potential for housing cooperatives in the United States is huge. Let's look around the world. For example, in Sweden, over 30% of the housing in that country is housing cooperatives. We could do the same thing here in the United States if we had better public policy and leaders in this country that would make a commitment to housing cooperatives.
The compelling reasons for expanding senior housing co-ops go well beyond bricks and mortar.
It leads to greater satisfaction. It leads to expanding feelings of empowerment. It leads to community involvement.
Fred Wood's company in Warren, Michigan, has invested in federally subsidized co-op housing for 40 years.
It gets people active who otherwise wouldn't be, people who otherwise would be, especially in subsidized housing, be passive recipients of federal generosity. Now they're kind of controlling their own destiny.
A champion of rural housing co-ops on responses from seniors.
They like the independence, they like the personal safety, the life satisfaction. They're happier, they've got their friends close by, and they felt that their physical health was much better.
Feelings expressed down in Arkansas reflect the same thing.
Our average age of our resident, by the way, is 78. Most of them don't plan on going anywhere else.
In New Hampshire, manufactured homeowners banded together, bought their park, and turned it into a 111-unit co-op.
We have absolutely no paid personnel in our cooperative. We have hired a management company that handles all of our collections, payment of our bills, and we're doing quite well.
With 2.5 million senior households in manufactured homes, there is enormous potential for co-op conversions. Then there are naturally occurring retirement communities. Apartment buildings or housing complexes, many of them co-ops. NARCs are concentrated in New York City, but they are spreading to other areas. Simply put, they allow seniors to age in places they know best. Nat Yalowitz runs the NORC Supportive Services Center in New York.
The simple and profound objectives of these community-based programs is to assist seniors to remain in their homes, their preference, remain independent, have an active life, and contribute to their community and help to continue to build it.
Terry Lewis of the National Cooperative Bank spells out a simple and convincing point.
The value of control over your own lives and the value of the support that a community of people who are in it together can bring you is extraordinary.
Bottom line, if we owe a meaningful housing choice to our aging seniors, co-ops clearly can help lead the way. Also clear is that this is a message the co-op community needs to share with the rest of the country. This is Gene Randall in Washington.